Hi, my name is Dr. Nicole Clement, and I'm a naturopathic doctor in Vancouver, British Columbia, and also the formulator of EON Therapeutics' natural and organic supplement line. Today's video is about boosting and balancing your immune system function. When you think of immune system, we usually think of warding off invading pathogens, i.e. a cold or a flu, but in actual fact, having a balanced immune system plays a vital role in your response to things like allergies this spring season. In this presentation, I'll go over some of the basics of immune system, understanding the battle when to boost, tonify, and support your immune system, the links between digestive health and immunity, and some basic 101 of probiotics, what you need to know, and we'll finish off with some general tips that you can do to support your immune system function. You're born without an immune system. Your mother's milk and your environment help shape your immune system function for life. Over the course of your life, your body has built up and trained troops that fight off invaders, i.e. pathogens, while minimizing the damage to your self-tissues. At the heart of the immune response is the ability to distinguish between self and non-self. A normal reaction is known as healthy reactions. This is when your body appropriately mounts an immune response against invading bacteria, viruses, fungi, and abnormal cells that have the potential to become cancerous. Whereas an abnormal response is what we classify as unhealthy reaction. It is an inappropriate immune response to things like cat and dog dander, pollen, dust, and even some foods that we eat. So what is a pathogen? A pathogen is known as any biological agent that causes illness or disease in its host. There are a variety of pathogens, including viruses, bacteria, fungi, parasites, protozoa, and even proteins, and collectively these are all known as germs. So let's look at our immune system in a little more detail. Our immune defense system is categorized into two main classifications based on how our body responds to the invading pathogen. First, our innate immune response is a non-specific immediate response in which our bodies need no previous allergen exposure. Whereas an adaptive and acquired immune response is like it sounds, is a very specific response that has been acquired due to previous exposure. So like I said before, your innate immune response provides you an immediate protection but is non-specific. Things like barriers, your skin and mucous membranes. For example, in your respiratory tract, you have cilia that trap pathogens and contribute to the removal of mucus, assisted by physical maneuvers like coughing and sneezing. Another form of barrier defense can be found in your GI tract. The hydrochloric acid and salivary amylase enzyme help to chemically destroy bacteria. An example of an inflammatory defense is when you cut yourself, a redness appears. This redness is caused by a signal molecule called histamine being released at the site of damage, and histamine then increases the blood flow to the area, causing fluids and white blood cells to leak into the area, and the white blood cells are designed to destroy invading pathogens. White blood cells are actually part of the adaptive or acquired immune response. They are built and trained against a specific pathogen that you've been previously exposed to, and this offers the host long-term immunity. So let's look at the difference between a cold and a flu. Sometimes, clinically, it can be hard to distinguish either one of them from each other, but there are a few things that characterize a cold over a flu. So a cold, you'll have symptoms that are more centered around the nose and throat. Symptoms will be more runny nose, sneezing, minor throat irritation, a mild fever, your ears feel blocked, and finally colored mucus. Whereas a flu or influenza, it more comes on suddenly with a high fever, and you feel sick enough to go to bed, and symptoms are more of a throat irritation in your lungs or your throat, a dry cough, a high fever, some shivering, sweating, and most of all, you feel aches all over. So conventional treatment may include antihistamines, decongestants, and NSAIDs. These drugs decrease your symptoms and make you feel a bit better, but they don't shorten the duration of your cold or flu, and it actually can prolong your sickness because these drugs suppress your body's own ability to fight infection. So the first stage is the most crucial time. At this early stage, you want to boost your immune system function. And if you catch it early enough, you may be able to stop it dead in its tracks. If you still get sick, then you still want to support your immune system and not suppress it with the aforementioned drugs. Be mindful, in this acute stage, this is when you are the most contagious. In the second stage, you're less contagious, but you feel the worst, which means that your body is fighting the infection. You want to keep supporting the immune system at this stage, and you can help to ease some of the symptoms discomforts with my homemade NyQuil remedy. It contains 1 teaspoon of honey, 1 teaspoon of lemon juice, and a cup of hot water. And don't forget to buy organic. In this last stage, hopefully you are on your way to recovery. Typically, this occurs around the first or second week, depending on the severity of the illness. But if either the cold or flu symptoms have not resolved, it's important to call your doctor, especially if you have any of the following severe symptoms, such as a persistent fever, painful swallowing, persistent cough, or congestion. These are all signs of more severe illness that may require antibiotic treatment. But for those who are still suffering from things like tiredness or keep having recurring illnesses, you definitely need to work at strengthening or tonifying your immune system function. So what about vaccines? I get this question a lot in my practice. The principal idea of a vaccine is to introduce the season's potential virus into the body so that your immune system can build up its soldiers against the virus. But it's only against this particular virus strain that they have isolated, so it's a guessing game. A healthy immune system will be able to fight off an invading virus on its own. However, individuals like elderly or immunocompromised individuals do not have the adequate immune system function and therefore may benefit from this yearly flu shot. A robust immune system is supported by your flourishing inner ecosystem. It is the #1 defense against all diseases from common cold to cancer. Since 80% of your immune system is actually located within your digestive system, a delicate balance of healthy intestinal flora is extremely important.